Should I have surgery for under eye wrinkles?
Under eye wrinkles are a common problem and often the first thing people recognize as a sign of aging. Since your eyes are so important in communication, a less than optimal appearance of your eyes can have a negative effect on how you are being perceived. I often see in consultation patients who pull on their lower eyelid skin, which shows a smoothing of those wrinkles. They believe that they have extra skin, which should be surgically removed. Unfortunately, many surgeons also believe this is the case, so they do remove a significant amount of lower eyelid skin during surgery. This often results in undesirable changes in the shape of the lower eyelids as well as complications which can negatively affect eye health. I'll discuss how I address under eye wrinkles in my practice and the steps I take to minimize the risks of complications. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. A wide range of cosmetic eyelid procedures are at the very core of my practice. As a cosmetic oculoplastic surgeon, I also do a lot of work revising and restoring eyelid surgery complications for procedures that were originally performed by other doctors. As stated earlier, approaching wrinkled skin in the lower eyelid as a problem of excess is often a setup for complications of eyelid position and subsequently eye appearance and health. The fact is that lower eyelid wrinkles is associated with changes in skin quality, not the result of excess skin quantity. Strategies to improve under eye wrinkles are based on ways to improve the backbone of the skin, the dermis, as well as the superficial texture of the skin, which is the epidermis. It is important to remember that eyelid skin is about 0.5 millimeter in thickness, and it is the thinnest skin in the body. For skin quality improvement at the dermal level, I often use platelet-rich plasma, or PRP, to improve eyelid skin thickness and health of the backbone of the eyelid skin. PRP is a concentration of wound healing and growth factors present in your own blood. We obtain this by drawing a patient's blood like a routine lab test and then spin it to concentrate a clear yellowish serum, which is PRP. The PRP can be placed by injection as well as by a skin boosting device. The effect is to stimulate collagen, improve blood supply, and thicken the skin. This also has an impact on the appearance of wrinkles. When it comes to laser treatment, which is generally indicated for people with lighter skin types, the strategy is to address both the epidermis and the dermis. For example, we perform a procedure with a long pulse erbium laser called Smooth Eye. The treatment uses a laser to address the dermis without removal of the epidermis. This avoids the need to take time off while the skin heals. This procedure is done over several sessions, 4 to 6 weeks apart. We often address under eye wrinkles at the same time when I perform lower eyelid surgery for under eye bags. I often use the fractional CO2 laser and apply PRP both topically, immediately afterwards, as well as under the skin during surgery. For people with darker skin, I use a radiofrequency technology such as Pelivay instead of laser. As is the case with many cosmetic skin procedures, there is an optimal benefit by doing ongoing care to keep the skin looking as good as possible. This includes the use of topical creams, such as in the retinol family of products, and in addition, there is value in periodic treatment with PRP and skin boosting. There is the occasional patient who comes in with folds of skin which they've had their whole life. And in this type of situation, I actually do remove some skin, and I use a method called a skin pinch. In my experience, under eye wrinkles can best be treated non-surgically. It is important to remember that the expectation should be in the improvement of the appearance of the wrinkles under the eyes and not the complete elimination of them altogether. When it comes to determining which approach would be best for you, I recommend you find a doctor with extensive experience with multiple modalities and that you feel comfortable with a strategy that's being offered. It's important because optimal skincare requires a long-term strategy. I hope you found this information helpful. Thank you for your question.